I heard about the Brevium stitch, I was like, wow, this thing exists, because we have always thought about how can we go into a practice that's been using somewhat very old computer systems, and how can we take this database and reach out to the patients who have not been seen in so many years. And when I heard about the stitch, I was really very happy to see that it would work. I have to admit, I was skeptical at the beginning. I was like, really, can you go into such and such PM system and do that? And we tried it, and it worked really well, and we're able to reactivate many of these patients. So when we go in and acquire practice, obviously there is a certain cost to that acquisition, but that cost is based on the revenue, on the actual revenue of the practice for that particular year. But there is all this hidden revenue that is sitting there that Stitch will allow you to access after the acquisition. And that really helps make the acquisition more cost efficient. And when you're acquiring another practice, then you know that, oh, I'm going to be able to use Stitch to go and bring even more patients in after the transaction is concluded. So in that sense, Stitch was really very, very helpful. One of the features of Stitch is that it allowed us to activate recalls in our own system, because by transitioning from their system to ours, we lost the capability of doing their recalls, the ones that were already in their system, ready to be activated. So that way, we were able to make sure that these patients are going to be captured. Because when you have a transition like this, there are so many moving parts and so many things that can go wrong. And sometimes there may be a new phone number or a new address. And so it's very stressful on the staff and on these patients. So when we automate things like this, it really takes care of one big aspect of the transition that we have to worry much less about.